I'm Karen Rose. I'm a licensed marriage and family therapist. I work with children and families, and one of the techniques I like to use is sand tray, and that's utilizing miniatures, just like this giraffe, and a tray of sand. It could be wet or dry, and the client gets to act out the story or tell a story in the sand using objects from nature, or again little animal figures. What's really exciting about working with kids is because they don't edit anything. Like, what you see is what you get, and actually as a therapist it's very refreshing because we're just going to the heart of things. I also see how you work with adults in that same way, because you can work with the wounded child, or the child that has the family wound. So even an adult, I could be working with the child inside that adult. And that's also very exciting because, again, when you really get to that place, it's not, there's much less grown-up censorship. A parent's going to seek therapy for their child because they're going to notice, either at school or at home or with friends, there's some kind of conflict, there's something that's not going well. The earliest probably the parent might notice is around 5 or 6. Sometimes when the child is first starting first grade, then there's an issue because the child socially has a hard time either sitting, sitting still or focusing. Certainly I would work with families in transition in terms of divorce and separation. That can be a high conflict time for a child. When I do therapy with a child, whatever's going on in the room is going to in some way indicate to me the bigger issue. However, like if a child doesn't want to talk, as I say to my parents, you can never make somebody talk. So the most therapeutic thing for me is to give that child space to be quiet, to be silent, and then for the child to really realize that I'm not gonna push them. I'm not gonna sort of do the same behavior that happens maybe at home or at school, where somebody keeps pressuring them to talk and to interact. And I think that can be much more therapeutic, where the child's given space to do what they need to do and not feel like they have to perform or in any way meet some external expectation. I think in all good therapy, the relationship is essential. And I think if you look at the research, they'll show that it's not the technique that makes the difference, it is the relationship. And particularly with children, because again, they have that very good BS meter. And I think kids know immediately when you're not really present with them. So I think the relationship is really important. And again, that's one of the things I think I enjoy about working with kids, is because I'm required to be genuine as well. I mean, the kids are going to be, but then that asks me to be genuine with them as well. Especially with teenagers, they immediately know when you're not really being true with them.